Please like and subscribe for more tips and skills. We hope you enjoy our skills video on changing bed linen while the resident remains in bed. Always remember your indirect care and safety tips prior to beginning a skill. Knock, introduce yourself, wash your hands, identify the patient, provide privacy, and explain procedure before beginning.
Come in.
How you doing, Mrs. Smith?
Good.
Good. I'm Cameron. I'll be your CNA today. Today we're going to be changing your linens. Is that okay?
Yes.
Okay, well I'm going to go ahead and grab some gloves and provide privacy, and we'll get started.
Okay.
Okay, Mrs. Smith, are you ready to get started?
Yes.
All right, I'm going to provide privacy. Okay, I'm going to start by putting the head of the bed down for you. Is that okay?
Mm-hmm.
All right. We'll go ahead and pull this sheet off. And I'll put this in the soiled linen bin. All right, Ms. Smith, I'm gonna go ahead and raise this bed rail so that you don't fall whenever I turn you.
Okay.
Okay. And first we're gonna start by undoing the sheet that she is under. Okay, and then we're gonna start putting our clean linen on. You wanna make sure that the linens don't hit the floor while you're unraveling it. And then you wanna start by doing the corners. All right, Mrs. Smith, can you go ahead and cross your arms so it'll be easier for you to roll?
Sure.
And then we'll go ahead and roll you in 3, 2, 1. And you can hold the side rail to keep you up. Okay, and then you want to start rolling the dirty linen under the patient. And then we'll start putting the clean linen under the roll, so that when we roll the patient back, they'll roll onto the clean linen and we can pull out the dirty one. Okay, Mrs. Smith, you can go ahead and roll back. All right, and now I'm gonna put this side roll up, Mrs. Smith, so that you don't fall when you roll this way. Then we can go ahead and put this side roll down. Mrs. Smith, keep your arms crossed for me as you roll that way, okay? 3, 2, 1. And go ahead and grab the side rail so you don't fall back over. Thank you. And then we start pulling the dirty linen off. And we'll put this in a soiled linen container. And then we grab clean linen and finish putting it on the bed. Make sure it's nice and tucked so it doesn't come out. Okay, Ms. Smith, you can come back this way. Is that comfortable?
Mm-hmm.
Okay. And we can go ahead and lift the head of the bed back up so that the patient is more comfortable. How does that feel, Mrs. Smith?
Feels good.
Okay. All right, Mrs. Smith, I'm gonna put the side rail down for you. And then we'll go ahead and get this top blanket ready. Okay. I'm gonna go ahead and tuck it under the bed, Mrs. Smith. Just let your feet stay warm. Okay. Are you comfortable, Mrs. Smith?
Yes.
Okay, Mrs. Smith, I have your pillowcase, but I don't want to forget to take pressure off the linen so that you don't get pressure ulcers on your heel.
Okay.
Okay, and then we'll start with our last thing, which is the pillow. Can you raise your head for me? Thank you. and then we go put our pillow, dirty linen, and all right, Mrs. Smith, you can go ahead and raise. Okay. All right, Mrs. Smith, I'm done. Let me go ahead and tidy up your bed a little bit. Any pressure on your feet down here?
No.
Okay. Okay. All right, Miss Smith, do you need anything else?
Just my call light.
Okay.
Thank you.
Here you go.
Thank you.
All right, thank you.
Always remember your indirect care and safety tips when ending a skill. Make sure the patient's call light is within reach. Their bed is in a low position. Make sure they do not need anything else. Ask them for their preferences related to privacy. Wash your hands, remove soiled linen and trash, and place in the appropriate receptacles. Make sure to keep linen off of the floor at all times. Never fluff soiled linen. Don't forget to put the bottom side rails down before leaving a patient's room. Bed rails can be considered patient restraints. Please like and subscribe and follow us on Facebook and Instagram, or visit us at www.faithforwardacademy.com.